Hey, thanks, President Randy. Appreciate it. The opportunity to introduce Bill Benoit, President, or I call him President of the hospital. I think the exact title it says here is Chief Operating Officer. Um, and Bill and I share a number of things, I suppose, including being named Bill, and a great first name, don't you think, William?
Absolutely.
Yeah. Bill is has recently, so he's been with UH Hospital since September of 2013 and had a number of positions that eventually landed him as president of UH Portage Medical Center in 2018. Another thing we share is we've both worked at the same hospital here in Ravenna. In May of this year, Bill was named and promoted to Chief Operating Officer for UH Hospitals, the South Market. And he may tell us a little bit more about what that includes, but as I know, UH Portage is, I think, the furthest south and east in UH's footprint. He is a graduate of the University of Toledo, another thing that Bill and I share, in exercise physiology. He also has a master's in occupational therapy from the what was then called the Medical College of Ohio, which is in Toledo. I think is part of the University of Toledo and Toledo Hospital Systems now. A graduate of Moorhead State University in Kentucky with an MBA. And so Bill does have a clinical background. That's one area where he and I differ. I do not have a clinical background. He's really worked, I know, hard to enhance all things at UH Portage since his tenure here. And we really appreciate that. Bill is married to Cammie, who is like him is a clinician. She's a clinical dietitian, teaches at the University of Akron, and they have two daughters, Haley and Addison. Bill is a graduate of Brunswick High School, where he grew up during high school, but he's a native of New Orleans. And the other thing that we share is we've both lived in Lima, Ohio, when he worked there at Memorial Hospital in Lima. So without further ado, Bill Benoit.
Well, hey, good morning, everyone. I love the non-auditory claps. Thank you. Thank you for having me. As I'm looking at all the pictures, this really is a group of wonderful, great individuals here in this community. Thanks for giving me a few minutes just to kind of share the hospital story a little bit with everybody. If it's okay, I'll share my screen for a presentation. Is that okay? All right, I got the thumbs up. All right. Can everyone see my screen okay? Thumbs up. Excellent. All right. Well, this is the hospital. If you haven't seen it, it's doing great, and I'm going to share a little bit of COVID stuff, but mostly about recovery and how things are going now. So COVID, the big monster thing that came after us. Just a little bit of a reminder, and I actually look at the slide deck that I presented, I think, to this group a little over a year ago. So if everyone remembers, way back in March last year, the state of Ohio sent out this analysis. So the UH census is around 100 or so, and they told us to be ready for 250 patients that would need admitted to the hospital. So you can imagine all of the work. You may have heard the story of how we were at the high school with the National Guard and literally pacing out where we were going to put cots and blankets and things like that. So lots of prep work being done with that. Many of you probably know Joe DiOrio with the County Health Department, Joan Seidel with the City of Kent, Brian Shackelford with the EMA. We became best friends very quickly as we were all trying to tackle this. So I wanted to share what really happened. So if I go back to this slide, this was just Portage. If I go to this slide, this is the entire UH system. So this is our census, meaning patients who were admitted, not necessarily just positive, that came to the ED and were released, patients that were admitted. So you can see here, back in March when this began, we had some ups and downs, but across the system, we were running 70 or so patients. Had a little dip and then went back up a little in the summer. Really thought things were going well in September. Things were starting to decline, and I think maybe gave many a false sense of accomplishment that we were doing great. We were on the downtrend. As you can see here, December and January were our worst months by far. So across the system, we had gotten up to almost 300 patients admitted per day. It was a trying time for many of us. Since then, we've de-escalated, a little uptick around May, but really far down at this point. Unfortunately, and knock on wood, we're going to be soon there. We here at Portage, we have yet to have a day with 0 COVID patients admitted to the hospital, but we're awful darn close. And I think today we have 1. So knock on wood, pretty soon we'll be able to celebrate 0. I also wanted to share a little bit of what our experience has been throughout the entire pandemic in terms of the age ranges. Many of you may know, unfortunately, this entered the nursing homes very early, and this made up the 76 or older made up a vast majority of the early patients. That's not so any longer. So this is the age grouping of patients who've been admitted to the hospital with COVID-19. So you can see it's really a pretty even split from those over the age of 20 to those of the age of 75. And I attribute some of this to the fact that, most of the skilled nursing facilities, as well as folks like Hattie Larlam, pretty much went on lockdown pretty quick. And that really helped to ebb the tide, excuse me, of that vast influx we were seeing from the nursing homes and the group situations of living. So what are our main barriers and implications? At the beginning, I would suggest a lot of it was just the unknown. We didn't know. Could you get it from touching a surface? Could you get it, when you were 20 feet away? Could you get it if you were walking behind somebody that had COVID? Well, one of our biggest one was staffing shortages. We had about 133 different staff members test positive for COVID here at some point. We believe about 130 of those were community acquired. And so they tested positive because of folks that they saw in the community. But in the beginning, one of the things that we could have done better is we didn't break up the break rooms. So we would have nurses take off their mask, share pizza, share things. A couple of our units, some folks we believe probably spread the virus through that. So not long after that, we broke up those break rooms to give people different places to take break. The CDC, ODH, and the UH system recommendations for personal protective equipment changed almost a daily basis in the beginning. And that was pretty rough to keep on top of all of that. Obviously, we started screening patients and visitors. Sorry, I'm losing my voice here. We enacted limited visitation. And of course, as many of you know, we had supply shortages. I still remember there was a plane with PPE for UH that was sitting on a runway in China, and the government of China seized that plane to keep in China for what their needs were. So really, it was a tough time. What we're proud about is we cross-trained staff, and when I talk about helping hands, really what we did is, we nurses volunteered, doctors volunteered, therapists, myself, we volunteered to help in any way we could. So we worked outside of our traditional areas. We did things a little differently. We had corporate nurses in the quality departments who stopped doing what they did every day and came to the hospitals to take care of patients. Obviously, we had a lot of folks who were flexing their hours. And then it evolved into ramping up the vaccine clinics. Um, Again, I think we did a great job of screening folks at our entrances. And, sometimes I'll share some things with everyone that might be a little eye-opening, but you would be very surprised at the number of folks on a weekly basis that came to the hospital to visit patients who would tell us they had just tested positive for COVID and still wanted entrance to the hospital. You'd be surprised the folks that we found with fevers and cough while we were screening them to come in to visit their loved ones. And we did develop a screening app for employees. And so we launched that many months ago, which goes through the typical symptoms for COVID and allows them to self-screen before they make their journey to work. But there were points in time when we would have up to 12 nurses who were not able to come to work in a single day. What we saw in terms of patients, we certainly saw an increased length of stay, an increased census overall, an increase in ventilator days, an increase in what we call urinary catheters, as well as central line days. And so those are things we track really, really closely. And a significant increase in the cost of care. Just for example, I'll put remdesivir on there. So remdesivir is an antiviral. We typically give that to patients who are admitted to the hospital, just for reference. So that's typically given, at least the latest I was told by our pharmacy manager, it's typically given for about 10 days, and it's $500 per day for just that medication, not including all the other costs associated with care. So our costs are still a little higher, but again, we seem to be on the downswing and doing well. What's really nice, and because we're dedicated, die-hard, laser-focused, and committed to catheter-associated urinary tract infections, central line infections, and infections of all kinds, we did not see an increase in those, even though we use those devices more. So I really, again, kudos to the clinical teams here who really dedicated to our patients, and we're able to make that happen. So what are some of the things sort of transitioning to today? What are we doing? So we did get some new beds. I want to give thanks to the county, Portage County, through some of the grant money last year. We were able to make some changes here. So we did get some new beds on our step-down unit. Those beds do all kind of great things that help us, but they also help alert the nurses when someone who's standing up, who shouldn't be standing up. They help take patient weights in a different way so we can calculate medication dosage. All kind of great things and they'll actually talk to the patient and tell them to, please sit down if they stand up, things like that. We finished new flooring on a few of our inpatient units. And I'm happy to say today, but a little bit ashamed to say that for those who haven't been in the hospital recently, we still had carpet on those units. I don't know if many of you know about infection control in hospitals, but you don't want carpet. That's real hard to sterilize. So we did do that, which is great. Our infection control physicians are very happy. We installed some whiteboards in every patient room. We did some updates to the emergency department. We had some broken flooring. We had some broken countertops. We had broken cabinets. We had a lot of broken things. So we did some replacement there to make it nice and clean and easy to clean, which is really one of the important things. And we've seen a tremendous increase in what we call our meds to beds program. Typically, if you're admitted to the hospital, we'll give you prescriptions to fill after your discharge, which means either you stop by the pharmacy then or you have to ask somebody to stop by the pharmacy. Now we'll fill your meds for you, your outpatient medications for you before you leave. We also have a retail pharmacy where you can come just like any other pharmacy out there. And that business is really skyrocketed. And really the biggest goal there is to help patients be compliant with the medications they've been prescribed. Our biggest goal there is actually not how much money we make. but how much money we save patients through the discount programs that are available to us, the coupon programs, and our pharmacists work really hard to make sure it's affordable. And that way folks can be more compliant and afford their medications and hopefully not come back to the hospital. So again, the top 5 impacts, I would say significant change in the way that we provided care. Urgent care volume went up tremendously. We did a lot of more telemedicine and a lot of physician office visits. Unfortunately, we saw delays in folks seeking care. This increased the acuity of the patients who were coming to the ED and that we were admitting. Our acuity levels are still very, very high for folks who are admitted to the hospital. I'll talk a little bit about that in a minute. Patient satisfaction trends and comments. In the very beginning, we had a huge increase in satisfaction as folks were just thankful that we still had staff here to provide care. And then more recently, we have a shift into, why are we still testing people and why are we still screening people? And again, it's very important for us to continue to do those things. We're laser focused on not spreading disease here at the hospital. So we'll probably continue to do those things for quite some time. Public perceptions, I would suggest, is one of the biggest struggles that we've had. For those who might not know, we've had incidents of violence. We've had folks who actually have broken into the hospital outside of our visiting hours, literally breaking glass and breaking in and assaulting nurses because we had limited visitation hours and they wanted to see their family member. We've had folks, I would say about every other day, we have someone who screams at our front entrance when we ask them the questions for COVID screening. And so we've had a significant increase in upset folks here at the hospital, which has been unfortunate. And I think from when I talk to law enforcement, they're seeing the same thing. And I'll also suggest that our number of assaults on nurses has gone up about 2-fold so far this year. So we actually do, unfortunately, have patients and or visitors that assault our nurses more often than we'd like, of course. I'd also suggest what we're still seeing, and I think what we're seeing in the community, and Nelson probably knows this better than I, our number of ED visits, urgent care visits, and physician office visits based on behavioral health and mental health needs is still at an all-time high. So this pandemic has really made an effect that's ongoing here in the community. So non-impacts. Luckily, our quality has continued to improve year over year, which we're very excited about. Our physicians and staff, I tell you, it's just amazing. And I may have told you the story before, but I'll tell it again because I still think it's amazing. I was rounding in our ICU during the height of the pandemic, and I asked one of our hospitalists what he was doing on the weekend. And he said he was updating his will because if he got COVID, he wasn't sure if he would live. And he was still at work every single day taking care of patients. So again, that's the kind of resolve that our staff here have, which I'm just proud to be a part of. I would say collaboration between departments. We had different departments helping each other in ways they've never helped before, which was outstanding. Collaboration between competing health systems. It's another thing I may have mentioned before, you may have heard me say before, but we had a ton of dedicated community members providing masks to us in the beginning of the pandemic. And again, the big question was, how do we sanitize those masks before we use them? SUMA had set up a aerosolized peroxide program for masks. I called and asked if they would be willing to do ours. Not only did they pick them up, process them, and bring them back that same day, but they offered to do it anytime we needed. So again, the competition, the coordination, when the Elkton prison started to kind of explode with COVID-19 inmates, we all gathered together. We stood up a transfer center, and we all started alternating taking some of those prisoners. So again, the collaboration was outstanding. Testing continues, but differently. And I'll share a little bit on that. You may have seen something about the Delta variant that's out now. I can tell you about 20% of the tests that UH does overall are now come back positive for the Delta variant. So it is very much here and very much a part of what we're we're still a little concerned about because the transmission rate is so much higher for that variant. So volume impact, what were we doing during this time in terms of volume? So obviously we suspended elective procedures for a couple of months last year. We were, aggressive in stopping those. We did a lot of marketing in terms of when it was safe to return. What we were very worried about was another pandemic of cardiovascular disease, cancer, et cetera, because folks were delaying preventative care and preventive testing. So I'll show you a little bit here. This is our cath lab. So this is inpatient and outpatient. Outpatient is what you probably need to pay a little bit more attention to. But you'll see, back in the early parts of last year, we saw a significant decline in that, right? And we would close some things except for emergencies. And then, the latter part here of the year, we saw a significant increase. We do believe that some of that was a little bit of a delay in folks reaching out for needed testing, a little bit of delay of folks, electing to come in for a diagnostic cath to make sure they didn't have blockage. We're probably getting past some of that now, but there was a little pent up demand there. This is surgery. So you can see, obviously, we stopped almost all cases. The only cases we did were emergency cases that couldn't be delayed. And again, you'll see later on, this year, beginning of this year, we saw a significant increase, and a little bit of that was probably delays in care. And then here's our discharges. So the gray is 19, the orange is 20, and then you can see where we're at here in 2021. So again, total discharges, we're right in the middle at this point. We're probably right at even. We have some highs and lows, but we're back to pretty much normal in terms of discharges. There was a point in time when about 30 to 40% of our entire census was COVID-19 patients. Now that's not the case. So that's been offset with typical patients that come through our door. And then here's our ER visits. Same thing, gray is 19, orange is 20, and blue is 21. So again, getting back to about normal for us, but acuity is still very high. So vaccine efforts. I have a very smart pharmacy manager, Scott Naples, who came to me last summer and said, hey, this Pfizer thing's coming out, and we're going to need a freezer and an ultra cold freezer. And if we don't order it soon, there's not going to need to be had. So we ordered an ultra cold freezer way back when, and luckily had it here by the time we started getting deliveries of vaccine. And we've been, we have Pfizer, Moderna, and Johnson & Johnson. We're actually store this for the county for their vaccine supply. And we're also backup storage for Kent State and the city of Kent here at our pharmacy. We continue to, continuous monitoring in all locations. I won't go into the details of the I-Sensix, but it wasn't cheap. We'll say that. And then, again, we're supporting others in this vaccination effort. And one of the biggest things I think I'm the most proud of, or one of the things we're the most proud of, is the Department of Health, the city of Kent and Portage County. We've been in lockstep since the beginning of this pandemic. They helped us when we were vaccinating some of our employees, and our employees helped them at some of the large mass vaccination clinics. So here's some of the joint teams that were out there. Anyone who could give a vaccine or qualify to do so, we did that. So we donated well over 700 hours to the Portage County vaccination efforts to help get those numbers up as high as we can. And that is all I have in terms of presentation. And I figured there might be some questions along the way. So I'd be more than happy to open it up if anyone has any questions that I'm qualified to answer. Again, I'm a therapist. I'm certainly not an infectious disease doc, but happy to answer any questions that I can.
Any questions for Bill?
I've got a first one, President Randy. Bill, thanks so much. That was an amazing set of statistics and really appreciate it and eye-opening for those of us that are not in healthcare. Just out of curiosity, can you share with us what percentage of the staff is vaccinated today?
Yeah, I think it varies a little bit across the entire system. Here at the hospital, we're probably a little bit over 70%. You know, and it's important too when you look at the numbers to, you know, sometimes you'll see you have all the people in Portage County. Well, does that include those who can't get it? Meaning those under the age of 12, right? Or is those taken out? You know, that kind of stuff. Some of the skilled facilities in the area are much lower than that, unfortunately. You know, it was interesting, as some of you probably saw in the news, when the governor came out with the Vax-A-Million, we saw a significant increase in the number of vaccinations, which was kind of interesting. Yeah, a little bit over 70% here at the hospital. In the entire UH system, I think at this point, we're probably pretty close to that. And again, there are plenty of conditions out there where folks are advised not to get the vaccine. You know, at one point, those going for fertility treatment, which unfortunately is more and more individuals. Some of the patients with undergoing oncology treatment. You know, and I talk about patients. Obviously, this is our staff too, right? Some of those are our patients as well. And so there are certain categories of individuals who've been advised not to, but there's certainly still a small percentage of folks who have not wanted to get the vaccine yet. And what we do and what we've offered since the beginning is our pharmacists do in-services for groups who are interested in learning more about the risks, the pros and cons of getting vaccinated. And they do, I think, a really good job of helping to educate folks. But yeah, probably here at the hospital, probably around 72, 73%.
I've got a question.
Yes, sir.
Roger Kramer. My wife had COVID early this year, and she went to her physician, who was a UH physician, and was sent home without any medication at all to help deal with it. Recently, we've been seeing studies that indicate that ivermectin is pretty effective in treatment if it's administered early on. And I asked the physician if they would recommend that to be available for a person to have available, or if they would recommend it for treatment in the case of someone who had early symptoms. And she was unable to do that, apparently because it's a policy not to do anything like that at this point. Has UH got a policy regarding that that you're aware of?
Yeah, UH does it now. Sometimes they do, but usually what happens is we've got the folks. You know, we've got plenty of physician experts and chairs and chiefs of service lines who typically help to write national policy on some of these medications. You know, not knowing exactly what was going on, and certainly I'm not a physician. You know, every case needs to be individual. I can tell you with the remdesivir, you know, often the physicians will only administer that if they're an inpatient and they need that level of care, because as with every medication, there are side effects. And so it's always weighing the side effects versus the intent of the medication. You know, a good example is, you know, sometimes folks will say, it's great that, you know, so-and-so was on a ventilator. Ventilators are bad. Ventilators do bad things to your body. They can cause organ failure. They can cause, significant lung problems. They can also cause, a lot of muscle wasting in your diaphragm that helps you breathe. But they're a great thing to save your life if that's where you need it. But sometimes folks will ask us, well, why didn't you use more ventilators? Well, there's always pros and cons to everything. I don't know of UH having a policy on the use of certain medications in an outpatient setting. They very well may have, but it's usually a decision of the physician with the patient and determining exactly what that patient, the pros and cons for that particular patient.
Bill, you mentioned, there's been some updates in flooring. We've heard about school systems and restaurants, updating their air handling system? Has the hospital had to do any kind of thing along that line, or is that already in place?
Yeah, I don't know if there's any folks who are into air handlers, but I don't want to ever talk to you ever again. But no, I'm just kidding. The air handling was one of the big things here. To give you an example, we certainly wanted negative pressure in every room where we had a patient that had COVID. To give an example of what we did, I'll give you two examples. One, we actually broke out the walls at every ICU room and made them negative pressure, installed independent HVAC systems that would filter out viruses to vent them outside of the building. Most of that has been repaired now because we don't need that many rooms, but sledgehammers were slung and HVAC experts were brought in. When the Elkton prison activity was going on, we actually housed those individuals in our PACU, which is our pre-op holding area. We have a skylight system there. We actually broke through the skylight and installed HVAC systems to exit that air and filter it before it went to the outside. In our entire hospital, we made significant changes to our HVAC systems, the filtering of the air, as well as where that air went. We actually had to trace every airflow from every room in the building to make sure that it was vented correctly, and the air coming in was the proper air to come in. So yes, it was quite the effort, and luckily we had many experts here helping us to figure all of that out. But the flow of air, you'd be surprised, is a significant issue in any hospital regularly, but certainly during COVID. Luckily, most of those things are back to their normal state, but we still do have rooms and areas that are negative pressure today that were not negative pressure when we started in the pandemic.
It sounds pretty expensive.
Yes, I can tell you I learned more about HVAC in the past year than I ever wanted to know.
Hey, Bill,
Roger
this is
Sidoti, you have a question?
Yeah, well, Bill, I'm just kind of curious. I think it was March of, right after the pandemic started, that you came on and you talked with us. And I was president at the time, and I remember listening very carefully. And you tended to, and I think you were in the same place all of us were. We were so unsure about this whole pandemic. And I can recall comments that you made about the number of dollars being expended and that you were projecting needing to be done. So I'm just kind of curious, if we had done nothing, where would we be today?
In what way? What do you mean?
In terms of the health of our community. If we hadn't, because you were gambling like we were, that we were doing the right things. If we hadn't done the right things, or if we hadn't done some of the painful things in terms of the dollars and cents, how did you see it as a professional, as a hospital administrator? How might it have gone if we hadn't?
Oh, yeah. Well, the problem is all about the timing, right? Mm-hmm. If we look at the total number of patients we've had here at Portage with COVID-19, if you told me, hey, Bill, you're going to get 2 more or 3 more each week for the next month, I can handle that, no problem. No problem. Our problem is when we had 40 at one time, right? Our bigger problem would have been if I had 100. If I had 100, well, and I'll share with the group, being pretty open, there were times during the pandemic that we ran out of morgue space. We were out, right? You probably know this more than most. And, we, and it's not very public knowledge, but, we had to rent a truck, and we rented a refrigerated truck that was parked in the back of the hospital for the bodies. And again, as you know, it's not just the patients dying of COVID, right? I mean, we have patients that come by EMS that we can't revive all the time. And so it was on top of those typical things. Worst case scenario and my worst nightmares, it was, where do we put all of the bodies? Because unfortunately, this virus didn't space itself out. It came in droves. And on top of that, if we were so consumed with that, If we hadn't done anything, if we hadn't started, preventing this in any way, I truly believe that we at one point would have had 250 folks who needed our care at the same time, on top of our regular patients, and many of those may have died because we just wouldn't have the resources, the staff, the clinicians to take care of them. And as you can imagine, if you sort of think, a lot of times I think people think of COVID patients and everyone else, it's the same, right? Some folks needed cardiac catheterization who had COVID. Some folks needed an appendectomy who had COVID, right? And so there were special procedures, special things we had to do for them when they needed services. So I think it could have been horribly bad, meaning bodies we didn't know what to do with, staff and physicians who may have passed, or who may have been so overwhelmed they just stopped. I think it could have been very bad. I'm very grateful, even though this past winter was rough for us. I'm very grateful that the efforts that were made at least helped to space things out so we could handle it. At worst, it would have been a March and April last year that many of us didn't want to think about anymore.
Well, I want to thank you. I thought you did a great job. I think you each did a wonderful job. When you look at it, you made some tough decisions, and I know they were difficult decisions, both financially and in the political climate that we were in the middle of. So, I just think you did a great job.
Well, I appreciate it. And luckily, I didn't have to do it alone. We really have amazing people in this county, amazing leadership in this county that really, we'd put the call out for help and they would help. And help showed up in all ways, shapes, and forms. There were groups of women who were sewing masks at our Streetsboro Health Center during the height of the pandemic. It was amazing. It was amazing community.
Well, thank you.
I have a question, Bill, just real quickly. Given that we have so many people in our community and also staff at your hospital who are not vaccinated, how dangerous is that in terms of the potential for a resurgence? And are you concerned that we might have a resurgence?
I think there's always a concern, and I'll share, just Bill, the hospital administrator guy. But I'll share a little bit of what I hear in the system by those clinical experts. And I think there's very much still a concern of, there's so many unknowns, so many variants that are out there at this point, so much still unknown about the children, right? And if this sweeps through our children really quickly, what will that mean for our children? And some of those stats, I think, as you saw, while the incidence of children needing to be admitted to a hospital is pretty low for COVID-19, it's still there. And heaven forbid something like COVID-19 were to get into the population at Hattie Larlam or other places like that, where it would be significantly worse. So I think, and like I said, we still have a lot of folks in the community who are very frustrated with us. So does Mr. Kalecki over at Hattie Larlam and others, that we're still screening and still restrictive. At the hospital, we'll probably be the last ones around to stop wearing masks and to stop screening. But we have to protect our patients. I still think there's certainly concern about, many surges in the epidemic. Yeah, probably not nearly what we had forecasted, last year. And so we're going to continue every safety measure we can by also balancing the fact that, many are vaccinated, and the positivity rate continues to go down a little bit. There are still pockets, though. Luckily, I'm on a call with the state of Ohio every Monday morning. There are still sections in the city of Akron that have less than 20% of the folks there vaccinated. So we're very worried about those groups, right? We're very worried about those communities that have 70, 80% vaccinated. Are a little less concerned, but those with really low rates of vaccination, very concerned about what that can do for that community, our employees that come from those communities, and how we can continue to serve the rest of the patients here that may not be COVID-19. So still concerned and still very much pushing the vaccination efforts in every way we can, as well as being very protective here at the hospital on, mask wearing, screening, et cetera.
Is UH considering mandating all staff be vaccinated?
Not at this time. That's not any conversations I've been a part of. It's a, and part of what we take our lead from really is the state of Ohio. And the governor of the state of Ohio, from what I understand so far, have said, look, most of these vaccines have emergency use authority, right? Not general clearance. And so it's kind of hard to mandate something that has emergency use and not general acceptance. We certainly encourage, and there are certainly things that vaccinated employees can participate in that others can't. There's not much, but a little. We're hoping people will make the choices that are right for them. But we also need to support the folks that either by their physician, can't get the vaccine yet. And we've had folks who were almost ready to deliver their babies and say, hey, I don't want to get it yet. I'm still concerned. And then after delivery, they have their baby. We also have new employees all the time that come in that haven't been vaccinated yet, that then take the opportunity to become vaccinated. So it's an ongoing process, not as heavy as it was before, but it's an ongoing process to continue to encourage folks to be vaccinated. And I think the best evidence is, of the 70-some% of us who have been vaccinated, we haven't grown a second head yet. So, I think more and more folks are being encouraged by the fact that the side effects don't seem to be too harsh, and there haven't, at least we're getting on 6-7 months now that, none of us have had significant side effects from it. So I think over time, more and more folks will be comfortable with it, but no mandate at this time.
Bill, as I know you're aware, we always have a responder to our speaker, and today that privilege happens to be mine.
Oh,
And we really appreciate you coming here and give us an update of what's happened to our local healthcare facility and our healthcare givers over the last year. I think it's been somewhat eye-opening. I think a lot of these statistics should be pretty sobering for some folks, like the 20 to 35-year-olds who think they're invincible are making up a quarter of the admissions. I think that's pretty telling. And the fact that you're being proactive with a lot of your repairs and programs is very hopeful to us. And so we appreciate what you've done and what you're doing. And thank you so much for taking your time to fill us in today.
Well, and I appreciate everyone, and certainly appreciate everyone who helped to contribute to the success of this and the hospital over the past year. So thank you.
All right. Thanks again. We are adjourned.